again, we can have box breathing, we can have mindful based exercises, other exercises. Box breathing is one thing. One grounding technique is 5, 4, 3, 2, 1. Since there are time constraints, I will not elaborate, but that technique is very effective when you are feeling very low and very anxious. There are one very simple technique which is 4Ds technique. It is like not like a magic. If someone is too much anxious and the person doesn't have time to contact professional, like the person is going for exam or an interview, and suddenly she or he felt that I am too much anxious to face the questions. This 4D technique is very basic and very effective. The first D is for drink water. The person has to drink water and you should drink in a gulp manner, not sip करके नहीं पीना है, बेटा भी. The second thing is deep breathing. So when you deep breathe, तो क्या होता है कि when you are anxious, you have this pounding heart, shortening of breath. So when you do the deep breathing, automatically your brain gets the message. Everything is alright. See, you are breathing in a very good manner. The third thing is distraction. So you have to distract your mind from that particular problem. Either you can do some grounding techniques, or you can do some like backward counting कर सकते हैं आप. Something where your mind will get engaged. And the fourth is delay impulse. Delay impulse means if you have impulse to just run away from that situation, not sitting for the exam. So for that, you have to put some alternative activity in your mind. कि walk कर ले, कुछ favorite playlist सुन ले, talking to your mom, talking to your best friend. So this is very simple technique. You should not use it for the long-term management, but for short-term crisis intervention, it is very effective. And in that toolkit, the fourth thing should be crisis intervention, जिसमें आपके पास कुछ contacts होने चाहिए. Like if you are going through low crisis, mid crisis or high crisis, so you should have contact number of people कि low crisis में किससे बात करूँगा. I think Vicky can be the best person. I can talk to my batchmate. Mid crisis में you should talk to your friend. पर अगर high crisis है, then you should talk to your family member, professional, और जो बहुत close person हो. Right? Apart from that, there should be activities specified there. कि I'll watch my favorite movie, I'll read this book, I'll talk to someone, I'll go to professional help, so that you will not go into maladaptive coping ways at that time, because you're already in crisis. So your mind will not tell you कि अभी ये करना चाहिए. So this is already prepared. So you know that this activity will help me out. So I think that is sufficient for that toolkit.
Amazing, ma'am. I guess the toolkit absolutely gets rid of the inertia that oftentimes people face when they are in a crisis mode. They resort to few of the easiest things, and I guess these are one of the easiest things: drinking water and deep breathing. Thank you very much. And my next question to Geeta ma'am. Ma'am, students often become the first line of support for their friends. And so I want to ask, like, what is the right way to support a friend in distress without taking on the role of a therapist?
I think it's very wonderful question, and I would say you don't have to become a therapist to help your friend, right? You don't have to fix their issue. What you have to do, just a very small example. Suppose if I ask you that you are carrying a backpack, this backpack is full of all your worries, all your tensions, guilt feelings, and disappointments, your future related fears, right? Not just feel, how you are going to feel at that moment with that backpack. You are going to feel heavy, no doubt about it. And suppose a friend comes to you and he asks you, can I just share with you? Can I just carry with you? Obviously, how you are going to feel. So you are not going to take the pain away from that person. Pain is there, but you are sharing it, right? This is something happens when we share our, difficulties, when we share our challenges, difficult situations. So sharing is something that helps a lot. So what you have to do as a friend, you have to be there, you have to acknowledge that yes, this person is going through the pain, and I have to be there to provide a safe space to the person. I would like to discuss one of the very major challenge. what happens? Most of the time, whenever we listen to someone, we just not listen, we just wait for other person to stop talking so that now we can speak, right? So we are all the time in our head thinking about that what I am, how I am going to reply, what I am going to suggest, what I am going to advise, and this is actually the major issue. Sometimes you just have to be there with the person because listening is something that brings some neural changes in your brain. So it is not only the psychological relief that you get. Actually, it has connection with the neurology. So that is very much important. So this is the way acknowledge their pain, be there with them, listen to them without any judgment, not to reply, not to suggest, not to advise, but just to be there with that person. And then at last, obviously, ask them to get help from some professional. Now again, though this point is not very much directly related to your question, but I would like to highlight. Whenever we say that they should go and get help from the professional, professional means one who is trained professional. Not everybody who is, who has qualification in psychology is a psychologist and treat mental health conditions. So not every engineer is IIT. Exactly in the same way, when you are going for seeking help, just check for their qualification, from where they are qualified, what is their qualification, and then we go for seeking help. That's all.
So, like a follow-up question on this, how should we identify whether let's say some counselors we are therapists, how should we identify based on their qualification or previous life whether this person should be the best one to share my problems with?
Okay. So we have a regulatory body, RCI, Rehabilitation Council of India, right? So the professional should be registered with that body as clinical psychologist. If one is doing psychotherapy process, I'm only focusing on the therapy process and counseling process. So for treating the mental health conditions, for providing the psychotherapy sessions, one has to be registered with the Rehabilitation Council of India as clinical psychologist or rehabilitation psychologist as well. And that is also one of the category that's there. So check for their license number. This is very much important. And if you want to go beyond that, you can go and check their qualification and from which of the institute they have qualified. But this is not something mandatory. I'm just giving you this suggestion so that you can be, more cautious about whenever you are choosing your therapist.
Thank you very much. Thank you very much, ma'am. Yes.
We are talking in future about after 2 years, there will be more confusion. Because
That's true.
there
Very
is
true.
basic degrees. Indian government has removed the basic degree of training, which used to be MPhil at one point of time. So people used to go BA, MA, MPhil, PhD, whatever. So now everything is gone for 6. And RCI has changed the courses and all. So even a BSc psychology will be an assistant psychologist and then MSc will be some psychologist. तो अच्छा वो तुमने आज ही पूछ लिया बेटा 2 साल बाद जवाब नहीं दे सकता
Exactly. After 2 years, it would be difficult to answer this question because now it is going to be MA in clinical psychology. So you won't be able to differentiate whether it is academic qualification or it is professional qualification. Whether it is RCI registered MA clinical psychology or it is just university related MA clinical psychology. So yes, very true.
Right. Absolutely. So, one of the questions. As we talked about the, one thing that a lot of times we find it difficult to identify whether beyond counseling or therapy we need psychiatric help or not. So, what are some of the definitive biological or behavioral red flags that may indicate a psychiatric help over counselor help?
Okay. So what I'm going to say, पहला thing करते हैं, when we were talking about suicide, if any of you at any point of time feels a little bit of pang of emotion, right? Please feel free to talk. Don't bottle it up. And psychologists also, please don't bottle it up when I'm going to say something. We should differentiate between what is counseling, what is psychotherapy, and what is psychiatry. Right? Counseling in traditional sense means a very specific problem and a very specific directed solution. Got it? I want to choose a career. I go to a counselor. Counselor works out, finds out, and suggests you the ways. Career counseling. You go to, IIT counseling the way it happens. ये आपका स्कोर है, ये आपकी ब्रांचेस है, होता है ना, सब निकले उससे. प्लस काउंसलर स्कूल में होते हैं कि बच्चा पढ़ नहीं रहा था, it goes and the counselor will talk. That is counseling. Counseling may not be a clinical thing, but psychotherapy is a clinical thing. That is what she was saying, that you need trained people. Psychotherapy is deeper. You present your problem, the psychotherapist analyzes, understands, goes and finds out your deeper processes, sometimes not deeper processes, but behavioral techniques which are supervised over periods of sessions, maybe whatever, 12, 16. These days psychologists and patients both are fond of doing 1 year therapy, which I don't understand. I have also been partially trained in psychotherapy, so, but anyway, they are changing times. And then there is psychiatry. Psychiatry is the medical discipline for teaching illnesses. Understand? So, let us be very clear. The diagnosis in psychiatry is a purview of psychiatrist. There is no second doubt about it. Because it was generated out of psychiatry. It was a clinical discipline. Now, a psychiatrist and a psychologist have to work in a team. So the first and foremost is diagnosis. A plan between the psychiatrist and psychologist, and it adds to your first question. Some medicine, psychotherapy, and both have to work in tandem. That is the essential. Lack of resources, lack of personnel, anything can lead to one person treating and all. Like sometimes I do psychotherapy because obviously people don't want to go and I reduce my psychotherapy to their follow-ups. Where do you go? Before when, what is more important is where. Like suppose if you don't have a psychiatrist in your city, you have some psychologist, you go to the psychologist. I mean, this is very surprising that most of the people who have psychiatric illness first go neither to a psychiatrist nor to a psychologist. They go to a neurologist, or to a cardiologist, or to a physician who will write medicines. Half the patients will improve with that. Because antidepressant will improve. You give antidepressant to everybody in this country, India will become happy. So, you understand? They don't try to make diagnosis, they know that this is depression, this is anxiety, and this is not psychotic or psychotic. And they prescribe like wonderful medicines which will cure half the things. So when they come to us, the first job of a psychiatrist is to give a diagnosis. So diagnosis is very important. She said it. Without diagnosis, people get more stressed. Although the flip side is, even problems of living are being labeled as diagnosis now. This total medicalization of life which is happening. And I give an example of this. And because we are a family, so there is no harm in confessing. Especially after COVID, counselors and psychologists are hanging like fruits. So many. But I have an example for this. And why I am saying this, I am taking one more minute. Suppose a young person goes to a not so qualified counselor or whatever, psychologist, and says, I have a conflict with my mother on the choice of my career. Is there a specific problem? Right? You go there, and then one of these, there are a lot of people who have suddenly picked up vocabulary from ChatGPT and Facebook and WhatsApp. So by the time 2 sessions happen, this simple problem of a conflict of choice of career So this person comes after 2 sessions and his whole lingo would have changed. जानते हो क्या होगा? कोई प्रॉब्लम लेके गया था भाई, रियल कन्फ्लिक्ट हो गई, फिर वो बात कर रहे हैं मेरी माँ टॉक्सिक है, मुझे वैलिडेट नहीं करती, ट्रॉमा है मेरे घर में। अभी क्या प्रॉब्लम होगा? सिंपल प्रॉब्लम को आपने अननेसेसरी you put veneers over it. That is the risk. So if there is significant disturbance, if a person is agitated, there is a risk of harm to self or others. If the person is not sleeping well, not eating well, and in some way harming occupational impairment, not studying, not taking care of oneself, first sign, go to the doctor. Right? Soft problems, concentration नहीं है, tension नहीं है, दिल टूट गया, all that stuff. You can come to a psychiatrist, but then psychiatrist should direct it to the psychologist. And if it goes to the psychologist at some point of time should bounce it to us to rule out if there is anything which is underlying which requires medicine. So, it's an imaginary line, too much disturbance, risk of harm, not taking care of oneself, drastic reduction in occupation, social impairment, right? So, doctor, first. Other things, you can go to a psychologist. It's like we work here, no? So you go to counseling service, they send it to me. I don't have to do anything, I send it to them. So it's not bouncing people, it's about what is required at what point of time. And all of us are sensitive enough to understand what is an emergency and what is not. You understand that? Isn't it? All of us have this inner knack and empathy where we understand this may be slightly going out of hand. Like if somebody is threatening to die, what do you do? We're talking about suicide and this is serious. Because if somebody is saying I will die and the person is getting agitated, what do you do? हाँ, emergency ले जाना मुश्किल है, physical blow कम पड़ जाएगा, मालूम है कैसे? But वो कैसे करोगे, that is a different question. But here, what is required is a medical assistance first, because it is the medical assistance which will settle this down, and then the person will be in a position to talk. Right? Because it's very difficult. I mean, see, we are not living in Kurukshetra, where Arjuna did not want to fight and there was Krishna sitting quietly. He said, "Chalo, I'll tell you something. I'll tell you a story of Mahabharata, then you will tell me the same answer." So let us use our empathy to decide what is required. On ourselves also. If you're feeling too agitated, and what she has said, if you don't find anybody to talk to, the easiest person to go to is a doctor. Even if you don't find a psychiatrist. All doctors know this much. Go to a MD medicine, go to any gynecologist, anybody. They know how to do it. But you have to be pulled out of a certain situation at that point. So keep this in mind. Sometimes it can fail, I am not saying it. Sometimes a person will be very quiet. He goes to a psychologist. Right? And it may be brewing inside. And it is not apparent, and we fail at times. We think it's a halka baat hai karke check kar lenge. Or it doesn't work. The person goes and does something or attempts suicide or does anything. So anyway, but that comes with experience, and still whatever things can fail. But if you have correct amount of empathy, which is the key word, I'm sure you'll be able to get it. And there are of course nitty-gritties which otherwise.
Absolutely. As we talk about this, I had some college-specific questions, sir. Mr. Nafid, I would like to answer. The college life is often filled with a lot of academic and social failures. Maybe a bad grade or a failed project or a social rejection, or a lot of issues that we have often in relationship issues. So, how can students reframe this concept of failure into an opportunity for growth rather than a trigger for despair? Given that we have been in these 4 years, we have gone through these 4 years, we give the best person to tell.
I'll answer this, but before that, I think सर ने एक पॉइंट बोला था कि दिल टूटे तो डॉक्टर के पास जाना चाहिए, तो मुझे लगता है दिल टूटता है तो डॉक्टर के पास तो नहीं जाना चाहिए. Because I think on a very light note, मतलब so just connecting to your question कि of all the things जो भी आपने पूछा, तो what and because sir and ma'am जो है, I think they went more on the serious part of this whole thing, which was the suicide one, and it's a very loaded thing, so I won't be going into that. तो मतलब मैं जिस पे बात करना चाहूँगा वो है कि what should we do so that we don't reach to that tipping point, right? And most of the people जो मतलब हमारे कॉलेज में होंगे, of course there are certain cases which culminate to the level जहाँ पे आपको medical attention चाहिए होता है, and वहाँ पे जैसा कि बाकी speakers ने बोला you have to take that route, but most of the cases में there are situations जो आपने बोला कि sometimes we are so overwhelmed with our problem, हमारा जो खुद का problem है. For example, first year के I don't know कुछ students होंगे, आप लोग भी बहुत सारे लोग first year में होंगे, that's the time जब लगता है कि heavens will fall, मतलब grades आपके most of लोगों के अच्छे नहीं आएंगे. So of course there are like अच्छे लोग तो होते हैं campus में, but जैसे for example मैं जब था यहाँ पे तो I had a terrible first year because I used to live in hall 2, and hall 2 में भी मैं एकदम सबसे कोने वाले रूम में रहता था. तो रात में कुछ भी हो रही तो हमारी HEC हमें बाहर लेके जाती थी और बम्बू कटवाती थी, जो भी करना होता था स्ट्रक्चर्स और ये सब गैलेक्सी में. एंड आई मिस्ड माई सुबह का 8 बजे का क्लास, HSS हुआ करता था मेरा. आई डिडंट फ्लंक बट आई केम इन DSB डिपार्टमेंट, एंड सबके साथ ये होता है कि ब्रांच चेंज करेंगे, गेट इनटू कंप्यूटर साइंस और पढ़ाई करेंगे. बट 5-10 दिन बाद मुझे पता चल गया था कि मुझसे वो होगा तो नहीं, क्योंकि ये तकनीक और क्या क्या चीज़ें हो गई थी, एंड मतलब करना हो रहा था. इट वॉज वेरी डिफिकल्ट टू नेविगेट, एंड आई एंडेड अप हैविंग अ वेरी पुअर CGPA. आई थिंक 26 वर्ग की पड़ी थी मेरी, एंड उस टाइम आई थिंक फेसबुक चलता था, आपको पता नहीं इंस्टाग्राम चलता है. एनीबॉडी कुड राइट की 10.0 दिस सेमेस्टर, एंड मेरे पास लिखने के लिए कुछ नहीं था. 6.0 क्या लिखूँ, तो उस टाइम ऐसे फील, और बिकॉज देयर आर सो मेनी ब्राइट पीपल इन IIT, तो यू ऑल्सो एंड अप डूइंग पीयर कंपैरिजन, व्हिच इज अगेन अ थिंग दैट मतलब डज मोर हार्म देन कुछ भी बेनिफिट करता है. तो माय सिंपल मैसेज, एंड इवेंचुअली आई ग्रेजुएटेड विद अ वेरी हैंडसम CGPA थैंक्स टू माय डिपार्टमेंट व्हिच वाज वेरी चिल, एंड 2 हफ्ते पढ़ने के बाद यू कैन इजीली स्कोर 9.5, एंड उसके बाद आई स्कोर्ड डिसेंटली वेल. सो आई ग्रेजुएटेड विद a decent CGPA, I got a good job, and so my point is कि उस टाइम पे ऐसा लगता है कि जब आपकी ग्रेड अच्छे नहीं आ रहे हैं, especially academics के कारण most of the people who get stressed, or I wouldn't say कि वो suicide वाला point होता है, and I am not a person who is qualified enough to talk about that, so I won't talk about that. But 2 things which I feel leads to कि हम अपने problem को over magnify कर देते हैं. One is the grades, जो हमारे एग्जाम्स हमारे खराब होते हैं, और सबके ही होते हैं, बारिंग फ्यू सोल्स हु आर लाइक एक्सेप्शनल. तो माई सिंपल जो मैंने अभी तक सीखा है, उस टाइम मुझे भी लगता था कि ये कोर्स ड्रॉप कर दें और ये कर दें वो कर दें और कुछ भी अच्छा नहीं हो रहा है. बट माई वन स्मॉल मैसेज जो मैंने अभी तक अपनी लाइफ में सीखा है और 4 साल के कॉलेज में सीखा है कि इन शॉर्ट टू मीडियम रन चीज़ें अच्छी हो जाती हैं. So if you have that thing in mind, if you are mindful of that thing, कि चलो कुछ भी अच्छा नहीं हो रहा, but back of the head में ये चीज़ है कि चलो अच्छा नहीं हो रहा लेकिन ठीक हो जाएगा. It's very easier said than done, but believe me, someone who is like 10 years more experienced than you, who is still struggling to figure out his life, things do happen, ठीक ठाक हो जाती है. तो ये चीज़ को मतलब अपनी पिक्चर के हम हीरो तो होते ही हैं, बट उस चीज़ को थोड़ा मेलो डाउन करके कि ये बैक ऑफ द हेड में रखना चाहिए कि थिंग्स विल गो बेटर, थिंग्स विल बिकम बेटर. having being mindful, जैसे mindfulness is a whole concept, मतलब मुझे बहुत समझ में नहीं आता है, but what I believe is कि you have to be mindful of the fact कि तुम्हारे साथ बार बार बुरी चीज़ नहीं होंगी, अच्छी चीज होंगी, जस्ट वेट फॉर दैट, बी परसिस्टेंट, बी रेजिलिएंट. सो इट्स अगेन आई एम रिटरेटिंग कि इट्स डिफिकल्ट, क्योंकि उस टाइम पे वी आर सो फुल ऑफ आवरसेल्व्स, कुछ भी अच्छा नहीं हो रहा है, तुम्हारे बगल वाला दोस्त फेसबुक और इंस्टाग्राम स्टेटस डाल रहा है, तुम्हारे पास कुछ भी नहीं. सो it's easier, it's very easy to get overwhelmed, but just having a belief कि things will get better in the long run, or not long run, मतलब short to medium run, is thing to go forward. And second thing मैं ये बोलना चाहूँगा again उस चीज़ पे, and this holds true for all the people here. मतलब there are normal people also who are living their life बहुत peacefully, बहुत उनका अच्छा चल रहा है सब कुछ. The thing is कि you have to reach out to people. मतलब बहुत हम लोग बहुत shy होते हैं. For example, one of the things that have benefited me, and I have my shares of ups and downs, both in college and outside. Like speaking out और लोगों से बात करना is very important. Like if you are like that kind of person, जैसे बहुत लोग होते हैं कि introvert होते हैं, but even if you are introvert, like find a mate, एक ऐसा दोस्त या कोई भी हो सकता है वो इंसान, but if you have a good friend, just talking, मतलब बात करने वाली चीज़ is very important. Like have someone who you can like talk, like if you are in a relationship, you can talk to your partner, talk to your girlfriend जो भी है. If you have a very good friend, just talk. मतलब नहीं बात करने का कोई फायदा नहीं है. मतलब बहुत बार ऐसा होता है कि हमें लगता है कि हमारी प्रॉब्लम बहुत ही सीक्रेट है. देखो आप में से कोई भी प्रधानमंत्री तो है नहीं कि आप मतलब बात कर रहे हैं कि आप क्या